Epilepsy is traditionally treated with anti-seizure medications. Although they can be extremely helpful, these medications may not work for everyone, and as with any medication, they can come with risk of many side effects. Some people with epilepsy turn to natural treatments and alternative therapies to help to relieve their symptoms or to complement their treatments. From herbs and vitamins to biofeedback and acupuncture, there are a number of things that can be beneficial. Some of the most commonly used herbs for epilepsy are burning bush, groundsel, hydrocotyle, lily of the valley, mistletoe, mugwort, peony, skullcap, tree of heaven, and valerian. According to a 2003 study, a handful of herbal remedies that are used in traditional Chinese, Japanese, Kampo, and Indian Ayurveda medicine have shown anticonvulsant effects. Still, there's no randomized, double-blind controlled studies to support their benefits yet. Certain vitamins may help to reduce the number of seizures caused by some types of epilepsy, but keep in mind that vitamins alone don't work. They may, however, help some medications work more effectively or reduce your necessary dosage. Vitamin B6 is used to treat a rare form of epilepsy known as pyridoxine-dependent seizures. This type of epilepsy usually develops in the womb or soon after birth. It's caused by your body's inability to metabolize vitamin B6 properly. Although the evidence is promising, more research is needed to determine whether vitamin B6 supplementation benefits people with other types of epilepsy also. Severe magnesium deficiency may increase your risk of seizures. Other research suggests that magnesium supplementation may reduce seizures. A 2012 hypothesis published in Epilepsy Research supports this theory. The best form of magnesium to use is magnesium bisglycinate. You want to start to slowly increase your dose until the side effects of stomach discomfort or diarrhea is noticed. Then slowly reduce the dose until you're able to determine your maximum tolerable daily amount of magnesium that doesn't cause any stomach discomfort or diarrhea. As magnesium is required for more than 300 functions in your body, a few months of supplementation can provide profound benefits to your health. Some people with epilepsy may also have a vitamin E deficiency. A 2016 study found that vitamin E increases antioxidant abilities. This research also suggested that it helps decrease seizures in people with epilepsy whose symptoms aren't controlled by conventional drugs. The study concluded that vitamin E may be safe to take with traditional medicines for epilepsy. However, more research is needed. You want to make sure that you take a mixed tocopherol food form of vitamin E and not a synthetic form. Medications used to treat epilepsy may also cause biotin or vitamin D deficiency and worsen your symptoms. So you want to make sure to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Vitamin D also works synergistically with vitamin K2, therefore 100 to 300 micrograms per day of vitamin K2 should also be taken. A meta-analysis published in April 2017 also demonstrated there was a correlation between stress and epileptic seizures. A team of researchers at the University of Cincinnati's Epilepsy Center examined 21 studies in order to carry out the review. The studies, which were published between 1980 until 2017, were based on various sources such as functional magnetic resonance imaging results and accounts of patients who'd kept journal entries of stressful events and subsequent epileptic attacks. The research team observed an increase in seizure frequency following high-stress events such as war, trauma, or natural disaster, or the death of a loved one. The scientists specifically cited a 2002 study that demonstrated the effects of the Croatian War in the early 1990s on pediatric health. The health experts observed that children living in war-affected areas had more episodes of epileptic seizures than those not affected by the war. Stress, however, is a subjective and highly individualized state of mental or emotional strain. You can check out my video on nervines and adaptogens, and my video on mental health conditions, and on the MTHFR polymorphism, and also research the pregnenolone steal for more information on some of the many ways to help to control and reduce stress in your life. Charlotte Figge and her parents have become well known for treating her seizures with a specialized strain of marijuana, affectionately named Charlotte's Web. Charlotte had her first seizure at just 3 months old, but before long she was having multiple seizures a day, and they could last for up to 4 hours at a time. Charlotte was eventually diagnosed with Dravet syndrome, which is a rare seizure disorder, and she was suffering through an average of 300 grand mal seizures each week. All medication seemed to fail her, and eventually the family ran out of options, except for medical marijuana. After just a few doses of cannabis oil derived from a high CBD, low THC plant, it became clear that the treatment was working. At 6 years old, Charlotte was down to just 2 or 3 seizures per month and was making great strides all around. And her story has inspired many others to believe that cannabis could be the cure that they've been hoping for. There was one boy, Jaden David, who was on 22 different pharmaceutical drugs and still experienced seizures. One day he even had 500 seizures. His father gave him cannabis oil and was able to successfully not only control his seizures, but also take him off the 22 prescription drugs. A recent scientific review of cannabidiol, which is a major constituent of the cannabis plant, that's commonly referred to as CBD, found that this powerful cannabinoid actually works better than pharmaceuticals at keeping epilepsy under control, though how it does this is still unknown. Hemp-derived CBD is now legal in many countries. However, it can still be very expensive when you take into account that doses for seizure control can range anywhere from 200 milligrams per day up to 1,000 milligrams per day. A pure CBD crystal extract from a wholesale shop would be recommended, as many tinctures only contain tiny doses of CBD and are massively overpriced. The body's major antioxidant, glutathione, is among other nutrients like vitamin A, C, and E that are often found to be deficient in individuals experiencing seizures. The ketogenic diet, utilizing fats as fuel for the brain, is known to boost glutathione levels. Some ways to increase glutathione levels involve taking the supplement N-acetylcysteine, which is a precursor for glutathione, at doses of 500 milligrams 3 times per day, ensuring that you have an adequate supply of selenium, which is 200 micrograms per day, or 3 Brazil nuts. You can take reduced glutathione or liposomal glutathione. However, a new form, S-acetylglutathione, when dosed at 200 milligrams per day, was shown to be as effective as 1,000 milligrams of intravenous glutathione, or in other words, around a $40 bottle of S-acetylglutathione was shown to be as effective as around $4,000 worth of intravenous glutathione. Also, if your body is under toxic exposure, for example, from mercury amalgam dental fillings, you can have depleted glutathione levels. Therefore, it would be advised to have these removed. 500 milligrams per day of vitamin C and 600 milligrams twice per day of alpha-lipoic acid have been shown to enhance glutathione recycling in the body. Therefore, it would be advisable to also consume these. Traditional herbalists consider Lobelia to be one of the most powerful and useful herbs on the planet, and they use it in a variety of herbal formulas. Lobelia is an adaptogen, or a thinking herb, meaning that it will take the beneficial phytochemicals in other herbs with it to places in the body which need it for healing. Lobelia is one of the best herbs for removing congestion, whether in the respiratory tract or in the central nervous system. It's also an effective detoxifying herb. Scientists currently seem very excited about the possibilities of Lobelia for epilepsy. In 2012, the Asian Pacific Journal of Tropical Biomedicine published a clinical study involving Lobelia in epileptic mice. Lobelia was observed to stop convulsions and seizures by enhancing the GABA release mechanism in the brain. Lobelia also kept the mice in the test group alive. Because of its balancing effect on the body, the famous herbalist Dr. Christopher would include Lobelia and cayenne in all of his herbal formulas to enhance their performance. Certain dietary changes can help to decrease seizures. The best known diet is the ketogenic diet, which focuses on eating a higher ratio of fats. The ketogenic diet is considered a low carbohydrate, low protein diet. This sort of eating pattern is thought to help decrease seizures, although doctors don't know exactly why. Children with epilepsy are often put on the ketogenic diet. Many people find the restrictions challenging. Still, this type of diet might complement other treatment measures to help to reduce seizures. In 2002, Johns Hopkins Medical Center created a modified Atkins diet as a low-carbohydrate, high-fat alternative to the ketogenic diet for adults with epilepsy. The organization indicates that recent studies show the diet lowers seizures in almost half of those who try it. No fasting or counting calories is required. A decrease in seizures is often seen in just a few months. If on a ketogenic diet, which can be lacking in antioxidants, make sure that you take some antioxidant supplements, as a lack of antioxidants is related to cognitive impairment. You can check out my other videos on antioxidants, on inflammation, and on autoimmune disorders for more information about this. Some people with epilepsy try to control their brain activity to reduce the rate of seizures. The theory is that you can detect symptoms of an impending seizure, and then you may be able to stop it. Many people with epilepsy experience aura symptoms about 20 minutes before a seizure occurs. You may notice unusual smells, see strange lights, or have blurry vision. You may feel symptoms for several days leading up to an event. These symptoms can include anxiety, depression, fatigue, and bad headaches. Self-control methods are used to prevent or decrease the intensity of the seizure once it arrives. There are several techniques, all of which require good concentration and focus. Examples are meditation, walking, immersing yourself in a task, sniffing a strong odor, and literally telling the seizure no. The problem with these methods is there isn't a single technique to stop a seizure, and there isn't a guarantee that any of them will work every time. Another approach involves biofeedback. Like self-control measures, the purpose of the process is to take control of your brain's activity. Biofeedback utilizes electrical sensors to alter brain waves. At least one study found that biofeedback significantly reduced seizures in people with epilepsy who couldn't manage their symptoms with conventional drugs. Physical therapists commonly use biofeedback. If you're interested in this procedure, seek a professional with credentials. It may be difficult to manage your condition with self-control and biofeedback alone. Both procedures require time, persistence, and consistency to master. If you decide to go this route, be patient. Don't reduce or stop taking any of your prescription medicines without your doctor's approval while attempting this. Acupuncture and chiropractic treatments are sometimes considered alternatives to conventional epilepsy treatment. The exact way acupuncture helps isn't understood, but the ancient Chinese practice is used to help ease chronic pain and other medical issues. It's thought that by placing fine needles in specific parts of the body, the practitioners can help the body to heal itself. Acupuncture may change brain activity to reduce seizures. One hypothesis is that acupuncture may keep epilepsy in check by increasing parasympathetic tone and changing autonomic dysfunction. The practice sounds good in theory, but there isn't scientific evidence to prove that acupuncture is an effective epilepsy treatment. Spinal manipulations in chiropractic care may also help the body heal itself. Some chiropractors use specific manipulations to help control seizures on a regular basis. But like acupuncture, chiropractic care isn't widely viewed as an effective form of epilepsy treatment. Findings strongly suggest that coenzyme Q10 can be considered a safe and effective adjuvant to phenytoin therapy in epilepsy, both to ameliorate seizure severity and to protect against seizure-induced oxidative damage by reducing the cognitive impairment and the oxidative stress that's associated with chronic use of phenytoin. The best form of coenzyme Q10 is ubiquinol, dosed at between 100 and 400 milligrams per day. Recent evidence strongly suggests that resveratrol, the anti-aging substance that's found in tiny amounts in red wine, acts as an anticonvulsant agent, and it could be a very effective method for reducing damage in neural tissues and even for preventing seizure development in coadjuvant anti-epileptic therapy. Typical doses of resveratrol are 500 to 1000 milligrams per day, taken in the form of trans-resveratrol. The curcumin molecule has an anti-seizure potential in preclinical studies, including chemical and electrical models of acute and chronic epilepsy. Curcumin also possesses an anti-epileptogenic activity, as it reduces spontaneous recurrent seizure severity in a model of temporal lobe epilepsy. Typical doses of curcumin range from 1 to 5 grams per day, but due to its low bioavailability, it should be consumed with either biopterin, which is a black pepper extract, or taken with an oil such as butter, fish oil, ghee, or coconut oil.